Hi, my name is Lauren Smith. I'm a developmental therapist with Achieva Early Intervention, and I specialize in working with children birth to 3 years old and their families through a parent coaching model where I help give suggestions to parents on how they can help their child meet developmental milestones. So thank you so much for having me and being interested in child development and how to best meet your child's developmental needs. Today specifically, I'm going to be talking about development from birth to 1 year old. So we'll be talking about developmental milestones, also some areas of concern, some things you can try, and also how you can get involved with early intervention services if you have concerns for your child's development. So forgive me because I have some things written down, so I might be looking to the side every now and again. I just have a lot of information and I don't want to miss something and forget to share something with you. So first I'm going to talk about birth to 3 months old. So although it may seem like your babies are just eating and sleeping majority of the time, there is a ton of development that's going on at this point because your child is in a brand new world and they are trying to figure out how to communicate their needs in this world that they don't know yet. So you are also learning how to read their cues to be able to help meet their needs. So this communication piece between you and your baby and significant caregivers in their life is happening during this time, and it's so important, and it's the most important part of development that sets the tone for everything else that is going to go on in the first couple years of life leading into their adulthood. So you guys are rock stars in, trying to meet your baby's needs and learning how to communicate with each other so that you are on your way for the best outcomes for your baby in their life. So, some things that are happening during this time, milestone-wise, are your kids are learning to bring their hands together at midline. They're bringing their hands up to their mouth. They're increasing eye contact and maintaining eye contact with caregivers for short periods of time, lifting head and chest off the ground when they're on their tummy. They are gaining strength and showing head control when they are being held upright. So where you had to support their neck totally in the beginning, by 3 months, they should need less support at their neck when holding them. Also, swatting at objects that are in front of them, and they should be able to maintain a grasp on an object for a short period of time as well. They should be starting to extend their legs when you are lowering them to the ground so that their feet are meeting the surface. And sometimes kids at this point they might be rolling in one direction or another, and also tracking objects with their eyes and head. So able to turn to follow an object as you move it. Some things that you want to pay attention to is your child moving both arms the same amount, both legs the same amount, turning in both directions the same amount. Kids should not show a side preference at this point, and if they are, there are some things that you can do to help this. So positioning is a big way that you can help your child in getting more practice to the side that they are not using as much. So positioning, meaning positioning them, positioning yourself, positioning their bed or other baby equipment so that they are, the stimulation would be to the side that they are using less. So if they are typically positioned in their crib a certain way and, their stimulation or whoever comes to get them, they would be looking in one direction, try switching them to the other side of the crib so that they are needing to look in the opposite direction when someone comes in to get them. Also too, if you have a swing or something of the sort and you notice them looking in one direction at something specific reposition the swing so that stimulation is to the opposite side. And also positioning yourself. So, if you're talking to your baby and you notice that, oh, I usually sit on the right side and that's the direction that they're always looking, try sitting to the opposite side more. So it just gives them a little more practice to that side as well. So some other things just to consider is if you notice this along with your child having difficulty focusing on people or objects that are at a close distance to them, this could be an indication for, some type of visual issue going on. So definitely talk with your doctors if you're noticing your child has a side preference, along with having a hard time coordinating their eyes to be able to track or focus on an object at a short distance. Also, another area of concern would be if your child is unable to lift their head off the ground. It means some type of head control when they're being held upright. So tummy time is so important, and common misconception is it does not always have to happen on the ground. This can happen on your chest at an incline. This can happen with a towel rolled up underneath their chest and their shoulders. It can be over your leg. You can put them in a football hold where, they lay along your arm with your hand in between their legs so that they can lift their head to one side if they want to look at something in front of them. So the recommendation is 15 minutes at the least a day, and this does not have to be all in one sitting. So this can be done over the course of a day. And what I like to suggest, and what a lot of other therapists like to suggest, is after diaper changes, because how often are we changing our babies? Very often during the day. And even if you turn them on their stomach after a diaper change for 1 minute, you're getting at least 11 minutes right there. So it can be hard sometimes with all the other things that you got going on to set aside time to do things like that, but it is so important, and that is one way that you can easily work that into your day. And also for kids that seem to really not like it and cry, it's hard. It is hard because their gravity is against them, and they are going from not having much strength to having to be able to lift themselves on the ground. It's like, starting at the gym and, expecting them to be, yourself to be able to do all these different things. It's really tiring. So kids all the time don't love it. But there are ways that you can do it where it's not going to be super overwhelming for you and for them, just short periods of time a day. And as they get used to it, you just increase the amount of time that you have them on their stomach. But it is so, so important, because this really sets the foundation for many things, not only physical development, because they need head and neck control for lifting up, rolling over, getting on hands and knees, crawling, pulling to stand. It also is something that they need for feeding. They need to be able to sit upright to be able to safely eat their food. And this also is really important in language development as well, because these muscles all need to be developed to develop respiratory patterns that are needed for speech and language development. So it's not just physical. There's lots of other things going on there with that as well. So some other things that you can do if your child is not extending their legs to meet the floor whenever you are lowering them to the ground, you can do things like giving input to your child's feet. You can, massage them. You can kiss their feet. You can position them when they're in front of you, that their feet are on you, so that when they're moving their legs are constantly meeting a surface. You can also lay them on their back where their feet are touching a wall, so that they are just getting used to a surface touching their feet. and gravity isn't completely against them, when you are assisting them and lowering them to the ground. So that is some ways that you can provide some input, and hopefully they will start to get used to their feet meeting a surface and start extending their legs to be able to begin to work on bearing weight on their legs moving forward. If your child is having trouble tracking objects, the best thing to do is use yourself to meet them where they are staring, and you want to slowly move yourself to one side. And if you lose them at one point, I would pause and see if they meet you back. If they don't, then I would go back to where they are staring and try again. And you just keep doing that in little increments until they are able to completely turn. You can do this with toys, lighted toys as well. But, since children are so focused on their caregivers at this point, you are the best toy to be able to do this. So that is some ways you can work on that as well. So next I'll talk to you about 3 to 6 months. So kids by 6 months should be pushing up on their forearms when they're on their belly, and pushing up with their hands by 6 months. Bringing toys to their mouth for oral exploration. Also being able to sit with support from you. Controlling their head in various positions. So whether, you're holding them, whether they're on their stomach, or, you're rocking them certain ways, they should be able to maintain head control. And really that head lag should have decreased a large amount. Your children by 6 months should be rolling in both directions. So stomach to back, back to stomach. Being able to stand for short periods of time with support. Also showing different emotions and a desire for interaction. So mirroring emotions. You smile at your child, they smile back at you. Watching what's going on around them. So they're starting to be able to track moving things in their environment. And also increasing accuracy when reaching and grabbing for toys. So they are, instead of swatting and hoping that they meet the object in front of them, you will see them starting to be more accurate with their reach to be able to try and grab a toy. Also, they're watching what's going on around them. They are making open-ended vowel sounds and may start to make consonant vowel sounds like ba, ga, da. Also turning head to locate sounds. So if you are beside them and you start talking to them, that they are starting to turn to look at you, or possibly even some environmental sounds that are familiar to them. Someone knocking on the door. If you have a dog, the dog barking. You should notice your children not only showing awareness of a sound, but also trying to locate where it's coming from. Also, if some babies are starting purees at this point as well, between 3 and 6 months. Some things to consider is if your child is not rolling in at least one direction by 6 months, not reaching towards objects that are in front of them, not turning to sound or some moving objects, if visually they're not following objects in front of them. Not maintaining eye contact when someone's talking to them, or not mimicking some emotions such as smiling. Also, too, as your child's physical development is, coming about, tight muscles or really floppy postures are an area of concern. And different reactions when weight shifting, and you don't always want them to be super tight or super floppy. Obviously, they're learning to develop some protective reflexes at this point. So there are times that you are going to see them kind of stiffen up because they are trying to stabilize themselves. But if you notice that your child is stiff majority of the time, or they just kind of feel floppy majority of the time, this would be something that you would want to talk to your doctor about, or call the Alliance for Infants and Toddlers to potentially get an evaluation to see if there's a way that we can help you and your child start to gain some of this strength. So next I'll talk to you about development from 6 to 9 months. So babies are babbling consonant vowel sounds. They're beginning to play back and forth with you. So you can play little games where they do something, you do something, and they might continue doing it just to continue that interaction with you. They should be starting to look where you point. So taking that as a social cue that they need to look in a direction. Also being able to sit unassisted. And transitioning in and out of sitting. Also transferring objects between hands. So they should be able to have an object in one hand and be able to switch it over to the other hand. Also raking objects to pick them up. So if something is on the ground and they're trying to pick it up, they're using their whole hand to try to rake at it to be able to pick it up on their own. By 9 months, they should be starting to respond to their name when it's called. And responding to peekaboo and other anticipatory games. So knowing that something's going to happen just through a game that you play repetitiously with them. Kids by 9 months typically start to crawl at this point. Not all kids crawl, but I highly recommend that you encourage your kids to crawl because crawling really helps with strengthening. It helps with developing core muscles. It actually helps a lot with fine motor development as your kids get older because they are getting lots of input on their hands, which really helps with fine motor development moving forward. And they are also learning the sequencing pattern that you need to be able to walk, by, moving their right leg, then their left leg. So whereas some doctors will say, no big deal if your child doesn't crawl, I would definitely suggest at least encouraging as much as possible and providing opportunities for tummy time, being on the ground, being on their hands so that they're getting the input. Some other things going on is beginning to hear more consonant sounds, like I said, ba, da, ga, starting to imitate sounds, and also showing that they're aware if you imitate their sounds. And this is one of the most important things that I can tell you is always talking to your baby about what's going on and mirroring the sounds that they make, because that is going to help them learn how to communicate back and forth with someone, because that is what communication is all about, going back and forth with someone, your turn to talk, my turn to talk, and the way that you can help them notice this pattern is by imitating the sounds that they make so they can recognize that. And then as they get a little bit older, they might be more willing to imitate things that you start saying or doing. Kids at this point are eating thicker purees, usually introducing oatmeal and rice cereals at this point, soft toast, dry cereal, puffs, and some soft fruits. Some red flags to consider is difficulty sitting with support. Also limited to no vocalizations. Also not responding to sounds or familiar voices by trying to locate and turn their head to the sound. Not giving eye contact to caregivers. Not bearing weight on their legs, and not transferring objects. So the next area of development is going to be from 9 to 12 months. So your children at this point are beginning to pull to stand and cruise along the furniture by sidestepping, possibly taking steps at this point. Also learning to imitate some facial movements. So where they might be mirroring some emotions, they might start to blow raspberries, do some tongue clicking and things like that. Also clapping hands, waving, pointing should be developing by 12 months as well. They are learning to develop a pincer grasp, which is a thumb to a index finger to pick up small objects. Also, this is where you'll start to see stranger danger and separation anxiety, because they are learning object permanence. So even though an object might not be there anymore, they are recognizing that they once were there. So when you leave your babies at a daycare or with other caregivers, you might notice them starting to be very anxious and cry because they know, even though you have walked out the door, that you are still a person that is there, and they are wondering where you went. Also hands you a toy and engages with you for help. So your child might hand you a book because they want you to read the book to them. They might hand you a toy if it has buttons and they're unable to activate the toy, or they just might bring it to you to interact with them with it. Now's a good time too to start introducing the sippy cup. The earlier on that you do it, it's very helpful for when you start to transition your child off the bottle, then they are already acclimated to the cup at this point. Your children are exploring toys as well. So they are not only picking them up, they might be inspecting them a little bit or maybe kind of picking at them to see, different features of a toy. And they're starting to understand the uses of things such as a brush for their hair, cup goes to their mouth, and things like that. Toothbrush goes in their mouth. They're also doing a lot of in and out play, so releasing things into containers and taking things out of containers. And being able to look at a few familiar items when they're named, or people in their family. So if you said, "Where's Daddy?" That they may be able to at least look, if not point, to where these objects are, or people. Some things that children are eating at this point are soft fruits, soft or shredded, or small pieces of meat, soft vegetables such as squash, sweet potatoes, carrots, avocados for fruits. So some red flags during this time would be if your child is not starting to say words or have any word approximations at this point. Some kids can't say words totally, but they might say baba for bottle, or buh for book, for mama. So if your child doesn't have any approximations, that would be something to look into. Also, not pointing or imitating gestures such as clapping or waving or pointing. Difficulty getting to a standing position. Not looking for things that they saw you put somewhere. So an object that they really like, if they saw you hide it somewhere, not looking for it or noticing that you are moving it and putting it somewhere. And also not responding to their name. So in terms of helping your child get to a standing position, you can sit them on your lap if you're sitting on the floor and have something on a higher surface, such as the couch, or if you have some type of standing toy for them too. And you can help guide them at their hips and their thighs to help them get into a standing position. You place toys on the surface, so it's something that they are interested in, that you can, when they start to reach for it, you can help guide them into a standing position. And then give them some support at their hips so that they can maintain that position for a period of time until they start to sit back. A way that you can help them learn to squat to sit back is drop the object on the ground so that when they look down, you can assist them at their thighs and their hips to sit back down on your lap. So hopefully I gave you some good information to look for, and like some things to work on during this period of time. If you are finding that through your child's first year of life that you're having some concerns, they're not meeting certain developmental milestones, something that you can do is try to get involved with your local early intervention service. So the Alliance for Infants and Toddlers is an organization that is composed of lots of different service coordinators that coordinate services for families who call and refer their children for services. So it starts with a service coordinator, add in an independent assessment team that would come out and assess your child to see if there is any developmental delay in any of the areas of development. And if they find that your child is delayed in any areas of development, they will come up with what services may best meet the need of your family. So I mentioned that I am with Achieva Early Intervention before. I work for a service provider. So my company, and among other companies, would provide services to you and your family if your child qualifies for services. So picking a provider is very, very important. It's just as important as picking a pediatrician. So it is really good to do research ahead of time, because certain companies offer different things than other companies offer. For instance, Achieva, a lot of us are certified infant massage instructors. We also have a preschool readiness program that we offer as well, among many different types of therapies, such as developmental therapy, speech therapy, physical occupational therapy, nutrition services, vision therapy. We offer social work that helps families with various things, finding resources, also being able to manage stress of just, being a parent and trying to navigate through life with your kids. So this is something that we offer, and there are other companies that offer different things as well. So it's great to do, research so that you have a choice of which provider that you prefer to provide services for you and your family. So as I mentioned, to get involved with early intervention services, you would first call the Alliance for Infants and Toddlers and get hooked up with a service coordinator. They will talk with you and set you up with a date to have an evaluation for your child. Currently, they are doing Zooms because of COVID-19, but typically that would be an in-home evaluation. And then they hook you up with a provider, and services begin for you and your family. And this can be tailored to meet the needs of your child. There is also a tracking program with the Alliance for Infants and Toddlers that provides services, but it's just a little less often than the provider companies do, but that is also an option as well. So any concerns with development, at Achieva, if you ever want to email or give us a call, we'd be more than happy to talk with you about your kid's development, guide you through the process of how to refer your child for services, so that you have information kind of going into it, and you know somewhat what to expect, and we can help guide you along the way. So thanks so much for tuning in. I hope to meet with you guys another time, and hopefully you send me some questions and I can help with any information that you may need for the future, or some tips to help your kids or your family. I'd be more than happy to do so. You can follow us on Facebook at Achieva Early Intervention, and on Instagram at Achieva Early Intervention as well. And we really hope to see you guys soon. So take care. Thanks.